Welcome to the Real News Network. I'm Greg Wilpert coming to you from Quito, Ecuador. On Tuesday, the Trump administration took another step toward dismantling the Affordable Care Act, or Obamacare as it is also known. Health and Human Services Secretary Alex Azar announced that short-term insurance plans would be expanded from 3 to 12 months. Short-term plans do not need to follow all of the Obamacare requirements, such as covering pre-existing conditions, mental health problems, maternity care, and addiction, for example. Democratic lawmakers immediately rejected the new rules. Senate Majority Leader Chuck Schumer, for example, tweeted, quote, "Since day one, the Trump administration's playbook on health care has been to sabotage marketplaces, jack up costs and premiums, and then offer junk insurance that fails to offer protections for those with pre-existing conditions, coverage of essential health benefits, and more." Trump administration officials, though, say that expanding short-term care will give consumers more lower-priced options for health insurance. Joining me to discuss the latest change to Obamacare is Dean Baker. Dean is senior economist at the Center for Economic and Policy Research and is the author of Rigged: How Globalization and the Rules of the Modern Economy Were Structured to Make the Rich Richer. Welcome back, Dean.
Thanks for having me on.
So, first of all, what is the most important consequence, would you say, of expanding short-term insurance coverage from 3 to 12 months?
Well, these were less highly regulated policies, and they're proposing to regulate them even less than had previously been the case. The original idea in the Obamacare plan, as it was set up, is that, okay, people change jobs, they move into a state. There are a lot of reasons why you might want to be in a plan for a short period of time, and you need to be less concerned about that plan meeting all the requirements of a longer-term plan. If it's 3 months, it may not be that big a deal. This makes it 12 months, and totally throws out, or I shouldn't say totally, throws out many of the regulations put in Obamacare, most importantly, the one on pre-existing conditions. So they could say, okay, we're only going to give insurance to healthy people. Or alternatively, they could say, okay, if you have a health issue, we'll give you insurance. We're just going to charge you $20,000 a year for it. And the big issue here is that that fragments the market. If I'm a healthy person, I have relatively few health needs, I could go ahead and get a high deductible policy. They'll sell that to me because I'm a healthy person. And what that means is the rest of the market is less healthy. Those plans become more expensive. That's exactly the world we were in pre-Obamacare when we had another 25 million people without insurance.
So what is the purpose, though, of short-term coverage anyway? Shouldn't all people be covered as long as possible?
Well, ideally they would be, but again, someone may not want to pay for a full year policy if they're only going to be in a state for 3 months. They're about to get a job that will give them insurance through their employer. There's all sorts of reasons why you might not want to sign up for a full year plan. So the idea was that you could have plans that just fill a gap, a short-term gap.
So the Trump administration, though, is saying that this policy change would only affect between 100 and 200,000 people, and that this wouldn't be enough to impact the premiums for those who have long-term health insurance plans. What do you make of this argument that it's really not going to have that impact in the market, as you said?
Well, a couple points. First off, if we're just looking at the market and the exchanges, that's only around 10 or 12 million people. So even their 100 to 200,000 number that's about 2% of that market. But the other point is that that will grow through time. So if we just say right now how many people that affect given the market today, that number may well be right. But over time, a lot of people will say, well, I'm relatively healthy. I could get one of these short-term plans. They'll give me a good rate because I'm in good health. So telling me that this year will only affect 100 or 200,000, again, that's probably a plausible number. But if we look out 3, 4, 5 years, you're probably talking about a very, very different world where you have a lot of relatively healthy people signing up for these plans. They'll save money, no doubt about it. That's exactly the point.
So Republicans actually also eliminated the individual mandate, which required all U.S. citizens to have health insurance, and this was back in December, I believe. Now, according to some reports, the Trump administration is even considering to expand the short-term insurance beyond 1 year. Now, what would you say is the cumulative effect of all of this? Is this a death blow to Obamacare?
Pretty much, yeah. I mean, to my view, the key part of Obamacare was creating a unified insurance market where anyone can get insurance regardless of their health. And this is destroying that. So what this means is we'll be back to the world pre-Obamacare where suppose you have a heart condition, suppose you're a cancer survivor, you either won't be able to get insurance at all, or if you do have a company that's offering to sell you insurance, they're going to want 50, 60, 70,000 a year. That's what people paid or faced. I mean, not many people could afford to pay that, but those were the sorts of premiums a person with a serious health condition would have faced pre-Obamacare. We're going to be back in that world. And it's incredibly cynical because people in good health could get insurance. That's nice, but of course, they aren't the people who really need it. So as long as you don't really need insurance, you'll be able to get it. Great.
So looking ahead, what do you think might be the longer term consequence in terms of the possibilities of getting some kind of Medicare for all or a single payer system? I mean, considering that so many people are going to be negatively impacted by higher premiums and lack of coverage.
Well, I think the Democrats are already more emboldened. We saw that 17 Senate Democrats were co-sponsoring a single-payer type plan or Medicare for all type plan that Bernie Sanders was the lead sponsor of. And I think this is just going to lead to more support because basically if you destroy Obamacare, I mean, you can talk about saving it, preserving it, making it better. If you've destroyed it, well, then that's no longer the starting point. The question is, where do you move from? And I think we can talk about moving towards a universal Medicare system. I think it's very likely we'll have things like, say, lowering the Medicare age to maybe 60. I don't know if we'll do that in a single year, but we'll do that. And having some sort of buy-in, a universal public option, and other reforms like that that could hugely extend coverage, even though, as I said, we're not going to get to universal Medicare all at one leap. But we could certainly make a lot of good progress, and I think the Democrats will be emboldened to push that way, given, really pretty outrageous proposals on the Republican part.
Okay. Well, we'll leave it there for now as we continue to follow the developments. I was speaking to Dean Baker, Senior Economist at the Center for Economic and Policy Research. Thanks for having joined us again today, Dean.
Thanks for having me on.
And I'm Greg Wilpert for the Real News Network.